South American and Caribbean countries should have access to monkeypox vaccines by the end of this year, according to the Pan American Health Organization, PAHO. PAHO Director Dr. Carissa Etienne says the agency is working towards establishing a revolving fund for the purpose. Some countries have already received some vaccines, Etienne said at PAHO's weekly press conference on Wednesday.
PAHO, through the revolving fund, has started to deliver monkeypox vaccines to countries in our region. On October 4th, Brazil was the first country to receive an initial shipment of 9,800 doses. Chile followed, receiving its first shipment last Thursday, October 6th. Other countries that have expressed interest to obtain vaccines are the Bahamas, Belize, Ecuador, El Salvador, Guyana, Honduras, Jamaica, Panama, Peru, and Trinidad and Tobago. PAHO is working with these countries and the manufacturer Bavarian Nordic to complete requested deliveries by the end of the year, provided that the requirements are met.
Dr. Etienne reported that since the supply of monkeypox vaccines remains limited at this time, they should be used on a discretionary basis by the recipient countries.
It's important to note that PAHO was the first WHO region to make vaccines available to countries as part of the emergency response to the monkeypox outbreak. As supply is still limited, vaccination among high-risk groups should be prioritized. Let's note that vaccines are an additional tool to reduce monkeypox transmission. They should be used in conjunction with surveillance, testing, and effective communication and engagement efforts to reach those that are most at risk of infection.
Director Etienne noted that in the Americas, over 45,000 cases of monkeypox have been reported in the region thus far, which represents more than 60% of the 72,400 cases reported around the world in this latest outbreak. 9 out of 10 cases in the Americas, Etienne said, were among men, and almost 6 in 10 were among people living with HIV.